This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHD HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and happy Valentine's Day. How about that? We're going to talk about heart.
We are going to talk about hearts, all kinds of hearts. You know what? February brings up a lot of things.
That's
for everybody,
right. That's
John?
right. It's Heart Health Month and
That's
Valentine's Day. And so, yeah,
Makes
we're
sense.
going to talk about a lot of things here, as we always do on Health Watch, every Sunday, 8 till 9, here on Talk Radio 1210, WPHT. As you heard the man say, Dr. Molly Fantasia is here, the PhD doctor, and the executive director and founder of Innovative Medical Associates, located in Marlton, New Jersey. We'll do it all here, the who, what, when, where, why, and how of Innovative Medical and how they can potentially help you if you have a medical challenge. And we'll do that here through the course of the hour on Health Watch. 855-839-1210 is our number in the studio, 855-839-1210 if you have a question for Dr. Molly or a medical challenge that you want to run by her during the course of this hour. That's what you do. Pick up the phone and call us at 855-839-1210. Before we get into heart and all of that good stuff for Valentine's, Dr. Molly, let's talk about Innovative Medical and the who, what, when, where, why, and how.
Well, John, Innovative Medical is a cooperative venture with a group of healthcare providers who believe that although we work out of our primary care facility, my primary care facility, we find that we can do things a little better than the average bear. Part of that really has to do with the fact that we can do anything that any other primary care facility can do. So if you need a medication, we can give you a medication. If you need a prescription for physical therapy, we can give you a prescription. But you need your x-rays, you need radiology, we can do it all. And
Sure.
we do, no matter what, if people are involved in our program. But we believe that utilization of natural substances can augment traditional care, thereby reducing the side effects of some of the additional medications, pharmaceuticals, and help a patient maintain a quality of life no matter what the medical challenge is. So fundamentally, it's the use of nutraceuticals that then can augment a traditional kind of situation. For example, I think a good example of that, of course, is always high blood pressure and high blood pressure meds, because there are some categories in there that can really cause people to be fatigued, etc. We're able to augment that and lessen the fatigue from some of the cardiac drugs. In addition, we find that hydration is the best way to deliver these nutraceuticals, because we can then get to a therapeutic level, just like you would do. We titrate the patient to a therapeutic level as if they were on regular medication, because that's what you do. A good example of that is the Z-Pack, right? Which there have been plenty of them out during COVID, right?
That's right, yeah.
So you start one and then you gradually build up, your tolerance for the medication, and therefore you're able to actually arrest whatever the issue is that's dogging you.
Since I've known you, it's been over 20 years, but I never realized before all of these natural substances have therapeutic capabilities.
Properties.
I didn't really.
Properties.
I didn't know that.
It's the constituent in some of them. It's not necessarily, people say it all the time. Oh, it's just vitamin C. Well, vitamin C is a very unique molecule because it can be a pro-oxidant or an antioxidant. Mostly we're familiar with the antioxidant properties, but it can indeed be a pro-oxidant, which then actually helps patients with certain other conditions. So it depends on how you use it, what's the extract. But Dr. Molly, myself, I'm always looking at the therapeutic value of a particular extract. And there is a ton. God has graced us with a ton of them. For example, I think I used it last week, licorice. Licorice has a particular extract that has been known to help in liver issues and viral issues. but it's not the licorice itself. So don't run out and buy, cherry licorice or just plain licorice. Don't do that. Okay, it's the extract in the true licorice root that actually can arrest some of the issues.
You use hydration because it goes directly into your system, right?
Right, and we're able to bypass the digestive system, thereby reducing the amount of the particular constituent that may not be absorbed. So we're able, not necessarily all the time, to give someone a higher dose, but to give them an appropriate dose to effectuate the change we're looking at.
I was laughing yesterday watching TV. I love these weekend commercials.
Oh, there are plenty of them.
Orange juice commercial says high content of vitamin C.
Yeah, well, that's true for juice. It is true.
I was laughing because I said, "Boy, if Dr. Molly was watching this, she'd go, wait a minute."
No, it's a high concentration for as much as you can get when you ingest it orally. But it's nowhere near the kind of effect that you're going to get when we deliver it. And it's interesting. We also look at vitamin C very differently than most people. Yes, vitamin C is not, everybody's going to beat me up. Vitamin C is vitamin C is vitamin C. It is. But the extract, my belief is that the extract of vitamin C is very important for particular conditions. And really, I believe that's God-given.
When you say the extract,
meaning
is there,
where I get it from.
Okay,
like
so
either
there's
from
different kinds?
Sure. You can get manufactured C, which most people who go to these spas, that's what they get. You can get compounded C, which is what I generally do. And again, I have a compounder, and we use things extracted from tapioca, cassava, non-corn sources. You can get vitamin C from corn, but it's got too much sugar for many of the conditions I'm looking for. You can extract it from beets. So there's a lot of things we do.
Besides vitamin C, can you think of one or two natural products that you use quite often that is used to help people with conditions?
Well, I used one earlier, licorice root. Licorice is one of them. Certainly, I've used B vitamins that are non-manufactured, and certain forms of B vitamins that occur naturally in the body. So people look at cyanocobalamin. Well, actually, there's a good reason to use methylcobalamin, which is a different form of B12, and hydrocobalamin. These are found in the body as well, depending on what kind of biochemical makeup a patient has.
When you use these different natural substances or food products or whatever it is, we should really explain to people that you have developed protocols where you've put together all of these things, but for different conditions, for different challenges.
That's right.
You have over 600.
I do.
You spent a lot of time in the lab, basically.
24 years. 24 years. I mean, we didn't start out with 600, but 24 years, and I've had wonderful physicians intermittently who've come in and really helped me with this. And it's a very interesting thing. Also, there are certain amino acids that are found naturally, but there are others that have to be man-made. For example, EDTA is one. Now, I'm very careful with the EDTA. That's something we use in our chelation, and we'll talk a little bit about that later.
Yeah, we're going to talk about heart, being that it's Valentine's Day, and we're talking about that. But what we should also mention, because, we've been doing this show a long time, and you and I know each other well, and we know, like, a lot of the backstory. But some people may be listening for the first time and don't know that you kind of started this. You were from a traditional medical background.
I was a clinical laboratory science.
Right, and you started this.
I have clinical laboratory organizations that I belong to right now. So, I started this from my own journey. I realized that there is probably a better way, or let's put it to you this way, and a different way to approach a challenge, a medical challenge. And I'm still a believer in traditional medicine. When I say traditional, I mean Western medicine. That's what they call what we do. Going to your physician, a regular physician, you have cancer, you have a surgical intervention, get it out. If you need some other types of treatment, do it. I've never said don't do chemotherapy, don't do radiation. What I've said is we may be able to help you through that so that it isn't such a dire situation. Lots of people with cancer, they tend to have the side effects not from the cancer, but from the treatment.
And you've often talked about people who have done
Both.
traditional
Yeah.
and both,
Yeah.
and haven't done any traditional.
Right.
So you've often said that the
that's right.
best is a combination.
The best of both worlds.
Right, exactly. All right, we're coming up on our first break of the morning. Our show is called Health Watch, and you'll find us here every Sunday from 8 till 9 here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and founder of Innovative Medical Associates, Marlton, New Jersey. You have a question for Dr. Molly? Good time to call in. We always tell you this, and every week we get to the end of the show, oh, somebody's on the line. We can't take you. So call now. 855-839-1210 is our number, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. More Health Watch for today after these words. Back here on Health Watch, and as always, operators standing by right now at Innovative Medical Associates. While we're on the air, they're there. 856-489-0505 is the number. 856-489-0505. If you want to call and get more information, you want to make an appointment to sit down with Dr. Molly and go over your situation. Remember, the initial consultation is complimentary. All you have to do is call in and get an appointment. And believe me, getting an appointment with Dr. Molly is far easier than finding a place to get a vaccine. So
I would say that's true.
That's it. I mean, it's like call, make the appointment, and you're finished. I mean, talk about.
That's very funny.
Isn't it funny though? I mean,
It's true.
try to get a vaccine. That's a real good one. But the number again, 856-489-0505, and the website innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And of course, our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210. WPHT, 855-839-1210 is our number here in the studio. If you have a question for Dr. Molly or you have a medical challenge you want to run by her, good time to call in at 855-839-1210. Valentine's Day, and we decided we're going to talk, Dr. Molly, about heart health. You have a very interesting case from a long-standing patient who I know very well, very nice guy, and
it's an interesting case. This is an interesting case. As you know, I have a new doctor who's sitting in our clinic, and she's doing a lot of my charting for me, meaning she's looking at the charts, and we're putting together something because I would like to publish some anecdotal studies. And she picked out one of my favorite patients who's been with me a very long time, probably over, I would say, John, I can't remember a time when Harvey hasn't been in to see me, right? Can you?
I see him pretty much
right.
every week, yeah.
And it all started with his wife, and so he's been our patient for quite a while. Anyway, Harvey's with me, and he first came in with cardiac issues. He couldn't even walk, I guess, 500 feet. It was pretty bad. He has a very big business. He was working really hard, and it was a sort of an artsy business because he does cabinets. And, really fine cabinetry. So the bottom line is, just this past year, he got COVID. Not from our facility, he'll tell you, from being in his warehouse, et cetera, right, with the guys who came in and out, not really following some of the rules, which you can't help, I guess. When they go home, you don't really have any control of it. But what happened is, he started with me with an ejection fraction, which is how hard or how much blood the heart puts out. Now, you go and send a patient like that for an echocardiogram, which is like a Doppler study. I'm sure you know about them.
Of course, yeah.
Right? You've had one.
I've had
most cardiac patients, most patients have had it.
Exactly.
So he started with something in the 20s when he first came to me, when we first really started this 7 years ago. Oh, we have a call?
Yeah, we do have a call. So let's
hold the story.
Put that on hold.
Sure.
Jim, did I hear you say Mike in the Northeast? Oh, Frank in the Northeast. Oh, okay. Frank, good morning. Welcome to Health Watch.
Happy Valentine's, Dr. Molly.
Happy Valentine's Day to you, Frank.
Hi, John.
Hey, how you doing, Frank?
Dr. Molly, I got a new problem, if you're ready.
Oh, my goodness.
Last Monday, I had surgery. It was a hernia repair. It's been bothering me for 10 years.
Good.
So I got taken care of.
Good.
And just to let you know, I've had like 30-some operations my whole life, but never had pain. Never zero.
Mm-hmm.
This one hurt. it was laparoscopic. They made 3 incisions. They used mesh. But my problem isn't the pain. The problem is I have inflammation. My whole abdomen area is still pretty swollen. I'm wearing a binder, especially the lower, like by the belly button area where the hernia was operated on.
Of course.
It's still really, I'm wearing a binder, except they all washed up. It's still extremely swollen. Is there anything I can take, like over-the-counter thing that reduces inflammation?
Well, systemic, what I would do is, I'm sure that I spoke to you about arnica in the past. Now, you can't put it on the wound, right? But you can rub it.
Before.
Pardon me? You
I've
never
heard that before, no.
I think we mentioned it when you were in our office. God
you probably
bless
did,
you.
but I forget everything.
You're a good man. No, arnica cream, arnica jelly, you can rub that around and see how that works. And actually, you could run it sort of not near the wound, though, okay, Frank? Definitely not near the wound. It's called arnica. You can get that almost in any drugstore. Also, there's the homeopathic arnica that you can melt the little pellets under your tongue in addition to rubbing on the gel or the cream. And actually, it even comes in a roll-on. If your mom takes you over to the health food store, I'm sure your guy there can get it for you. But arnica might be something to do. It may indeed reduce swelling, and it will also give you a little pain relief. So please, Frank, go get that.
I'll try that. I'm trying naproxen. Naproxen's not doing anything.
Certainly take the meds, but I'm telling you what to use topically.
That sounds great.
Okay, honey. God bless you.
All right,
care.
Frank, good luck with that. Thanks for the call. Keep us posted. 855-839-1210. So let's pick up the story of your patient.
So anyway, of course, he went back into the hospital with the COVID. And in addition to the cardiac problem, he has very severe COPD, emphysema because he was a heavy smoker, and of course he had a little vice as well. And this is, drinking is a vice,
That's right.
and it's one I know about. My own sister had the problem and passed away from it. So believe me. But he's been sober and clean, and the bottom line is this. We have been looking through his recent records, and right along I was running the echo, and you would see that the echo improved like every 8 months or so. You could see it improved a lot. Even under the conditions of having COVID, his echo went up to over 55%. That's huge. That's huge. And
from 25
from when he started.
25, right?
Now,
okay.
I want people to understand, chelation had a lot to do with that. The EDTA binds, opens up blood flow. It's like a rotor-rooter, but not really. It really goes in, takes out the free calcium that contributes to the plaque. We also use something called Plaque-X that goes after, which is phosphatidylcholine, in a very specific way. And what's happened is we've able to increase his blood flow. Now, that being said, our chelation is a little different than a lot of other people because what we do then is we have a program where we actually start to give cardiac nutrition through the IV, John.
So, actually, it's appropriate that we're talking about this today because heart health and EDTA.
Broken hearts is not good.
Yeah. I mean, how many times when we started doing these shows years ago?
Many years
ago, right. You're making us sound older, Dr.
No,
Miller.
no.
But we started doing and pretty much
everything
was about heart.
Sure,
and about,
we were ahead of the game.
Right.
But what I want to get to is it isn't just the increased blood flow that works. Yes, that's a huge part of it because if you can increase blood flow, you increase the pumping ability, all that. But what you want to do is get your heart healthy. Now, we all know exercise, diet, the same stuff that a regular cardiologist would tell you. If you have hypertension, you should be on your blood pressure meds. He's on blood pressure meds that is prescribed by my medical director,
yes.
actually. So, yeah, of course. But what I'm getting at is that even with all of that, we improved his cardiac nutrition. We did that by using certain amino acids, okay? We've done it with things like a cardiac sugar, D-ribose. We did it with alpha lipoic acid, and on and on and on. So what I'm saying is that when a patient comes in to our facility and has a cardiac issue, and we're going to publish this actually, has a cardiac issue, we're not looking at just EDTA. which was the original recipe. It's been out for 25 years. It's the improvements that we've made on this recipe that we believe made the difference, along with a patient who is compliant with the outside things. And by the way, he is not. but he eats whatever he wants and that kind of thing. But the point being is that with a little compliance on the outside and what we do for the cardiac nutrition, we believe the outcomes are better than other people who are just doing the chelation.
Bottom line is from where he started to where he is.
With the addition of COVID.
Right.
Okay. He's still better off. Yes, he still has some lung issues, right? We cannot, I love it when these guys come in, they want me to address everything all at once.
Right.
Well, you know what? We have to prioritize
Right.
and do it one step at a time. I always tell everybody, one bite of the apple at a time, will
Right.
you? Give me a break. And give my docs a break, right? We would love to do it all, but that would make us magicians, not scientists.
Yeah. Well, it's interesting because it took him how many years to get to where he is, and then they want it all cured within a day or two.
Right. and actually, this is apropos to our men's health, which we'll talk about at the end.
Right.
But it's really a very interesting phenomena in that cardiac nutrition is very specific. If you understand what's going on at any time and you read the integrative literature, you'll see that it's the use of all these types of nutraceuticals that makes the difference.
All right, we're coming up on a break. We're at the halfway point of the show, which means you have plenty of time to call in if you have a question for Dr. Molly or a medical challenge. 855-839-1210 is the number, 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. We return more of today's edition of Health Watch after these words. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates. You can call them right now if you would like to make an appointment to sit down with Dr. Molly, because a lot of times we talk about different things here on the show, and you probably say to yourself, well, how does that relate to me? Pretty simple. You call, make the appointment, the initial consultation is complimentary, and Dr. Molly can explain to you how what she does can relate to you and perhaps your particular situation. Pretty simple. 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey. Again, the number 856-489-0505. And a lot of information is available on the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. Emmy is in West Oak Lane. Emmy, good morning.
Hi, Emmy.
You're on with Dr. Molly.
Hi,
How are you?
Hi, good morning. How are you?
Good, good.
Happy Valentine's Day.
Thank you. The same to you.
Thank you. Quickly, I have a question regarding the COVID. I think it's great about the vaccine being available, and I just have a question about, in addition to the vaccine, do you have a protocol that you recommend that would help strengthen the immune system?
You bet. And that's $1 million question. I'm glad you asked. Actually, yes, I believe that a high dose of vitamin C, zinc is very important because zinc actually stops the virus from actually attaching to the cells. We recommend 50 milligrams. Now, other people out there say 30, but the addition of a good zinc vitamin. I also believe in monolaurin, which is an antiviral. That's a natural product. These are things you can get in the health food store, by the way. We put our patients on an oral supplement, including what we give them in the IV. Obviously, hydration is extremely important. So also vitamin D3. Now, we like to give at least 5,000 units on an ongoing basis to many of our patients orally, but we can give up to 100,000 units injection, and we have an injection in a specific oil. We actually like to use grapeseed oil quite a bit because there are some other properties in that we like. But the basic protocol to maintain your health, and you're the second person this week who's asked me this, or I guess last week, and actually it really is something. You want to keep your immune system well. And in that regard, again, I'm going to tell you that high-dose vitamin C IV is very, very important. And I would also, in addition to that, use glutathione, reduced glutathione, for liver. You want to maintain your liver. And in addition, if you call my office, I can't recommend these over the radio, but I have 2 homeopathic products that I don't personally sell them, but I recommend them. One of which I'm not sure you can get on your own, but we have a stock of it in the office. But nonetheless, it is really a very good thing to keep your own immune system up. I think John and I talk about this all the time. If your immune system is working at an optimal level, you're less likely to have a bad case of it if you get it. And you might even avoid getting it. And God bless us, we should all be using our masks and also washing our hands more frequently. And don't, please, use the social distancing. But again, I'm going to tell you, I think we should start living life, though, a little bit.
Yeah, I do too.
Okay, because I think
you.
our mental health is also important. So that's how I'd answer this. Emmy, thank you.
Very good. Thank
God
you.
bless
And again,
you.
happy
Emmy,
Valentine's Day. God
thank you.
bless
Same to
I
you.
love
And
your
God
show.
bless
I
you.
really
Let's-
love your show, and I
thank
try
you.
to
Thank
catch
you,
it every
Emmy.
week.
Thank
Appreciate
you,
it.
thank you. And I think add a dose of prayer in here.
Okay.
We're good to go.
All right.
Thank you.
All right, 855-839-1210. I asked you a couple weeks ago off the air, and you said, well, you're getting vitamin C here, meaning at your facility.
Right.
And then you said, take vitamin D, D3,
Right.
which I do.
Right.
And then zinc.
Right.
So,
and then some of the other nutraceuticals
right.
that we talked about.
Right. So I do all of that.
And so do I.
Right.
And so do I every day, So, yes, there are some things you can do to maintain your health.
All right, 855-839-1210. Just wanted to mention real quick, you always talk about, hydration and the infusion and blah, blah. But I was watching TV, and one of the major hospitals in Philadelphia is offering infusion for those who just got COVID, and it helps them to, I guess, avoid a hospital stay.
I would imagine that's probably for patients who have had the exposure and don't have serious health risks or comorbidities. And they're using, but I don't know what they're using. I don't necessarily think they're using high-dose vitamin C.
Probably
However, I have heard of some areas in the country that seem to be a little more enlightened than Philadelphia, who are indeed using vitamin C and some minerals as well.
Well, I just wanted to tell you that somebody's copying you,
Well, I don't know if they're. Here's the thing. I love competition. It's good.
Yeah.
It can't hurt, and I keep my nose to the grind. My whole mindset is on my patients. I don't worry about competition or anything else that's out there.
Yeah.
I just keep my mind on our patients.
Kind of finishing up the
sure.
heart health thing with
Right.
your patient.
Right.
So now what's the course of action moving
he has
forward?
Now that he had the COVID and he's COVID free, he's going to be back twice a week, and we're going to start working on, in addition to his cardiac issues, his lung issues, and I have a specific kind of protocol that I want to put on this because, of course, he was on steroids and things like that to help get him through the COVID. That's wonderful. However, I also got another patient in this week, a wonderful guy who listened to us on the radio. He comes in and he had a cardiac bypass many years ago, cardiac bypass. But a little more recently, and he follows a very strict regimen of oral, which I loved when he came in. And this week he gets to sit with Barbara and me going over his particular nutraceuticals. I went over them briefly with him on the free consult and then when he came in for the first visit. But he has an interesting thing. He ended up getting some stents after the fact, and that's not unusual because, the bypass was a long time ago. But he's smart enough to know he wants to keep those stents open and patent and moving blood through this. And so he's been listening to the show, and he realized, guess what? I better come in for a tune-up in order to make sure these stents stay appropriately open. And I applaud him for that because it's sure a lot easier to do the chelation and the cardiac nutrition that I'm putting together for him this week. I'm actually working on his protocol, than going back in for more stenting, because at some point these stents fail. Now he's strict with his diet. I mean, relatively strict. He's still working. He's 66 years old. And he's just a smart guy. He really understands the mechanism of what chelation can do and how it can keep him going.
You said it yourself. It's a lot easier to keep the stent open than it is
to go back
to go back and get another one.
Well, just remember one thing: they don't take them out.
Right.
They just keep putting more in.
Right. And at some point, they got to say, "Well, that's it.
Enough."
Right.
Yes. And so, why not? Why not keep your surgical interventions open and patent and happy? Because this is a very comfortable procedure. We keep you hydrated. We check your kidneys. That's the other thing. You know, the way that we're managing the chelation, John, we don't need to have you sit there for 3 hours like they did in the old days. Reason being is we're not using a lot of we're using a lot of other nutrients to help support the EDTA that is man-made, but under spec from me, it's man-made from one compounding pharmacist that I use right down. I check kidneys and liver functions on an ongoing basis, and I will tell you that we've had wonderful, wonderful results with chelation therapy.
Okay, we're coming up on our final break of the morning, which means you still have time to jump in with a question or a comment for Dr. Molly. 855-839-1210 is our number here. 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. With Dr. Molly, I'm your host, John DeMasi. We return more of today's Health Watch after these words. Welcome back to Health Watch. Operators standing by right now, and don't forget they'll be there well after we leave you at 9 o'clock this morning. In fact, they're there all day, so if you want to, there's no holiday for Valentine's Day, all right? They'll be there. 856-489-0505 is the number. 856-489-0505. You may want to write that down because you say, well, I'll call later on, and then later on you didn't write it down. You say, what was the number? 856-489-0505. Innovative Medical Associates, Marlton, New Jersey, and their website, innovativemedicalassociates.com, innovativemedicalassociates.com. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. Dolores is in Williamstown. Dolores, good morning. You're on with Dr. Molly.
Good morning, Dolores.
Yes, good morning, Dr. Molly. We find your show very interesting and very informative, and I'm so glad that you are doing this. I'd like to know you're welcome. What's your opinion on treating the body with stem cell therapy using the adult stem cell activators?
Using the stem cell, what was that again?
Activators.
I think that's yeah. Go ahead. Tell me what you're talking about.
Well, they're called adult. Yeah, they're called adult stem cell activators.
I think that's a fine thing. I think that anything that will promote the growth of the stem cells in particular areas. Now, let me ask you this. These are oral, right? You're taking an oral product?
Yes, it would be oral.
Okay. Yes, okay. There are many nutraceuticals as well as certain extracts that people put together, and they call it a stem cell activator or stem cell subset. In essence, what it's doing is it's giving the stem cells. I will tell you this, in our clinic, when we use stem cells themselves, as well I do it, I can do them IV or IM, which means injectable. We believe in using the activators to sort of set those stem cells because it's giving the food to the stem cells themselves to help them grow, their growth factors and things like that. There are many stem cell activators out there. I'm not necessarily, that might be a brand name, and I'm not familiar with that one in particular, but I do believe there are many out there that include certain cytokines that enhance the communication between the cells, and that's really what it's doing. So, yeah, I have no no opinion that it's bad. I think it may be very worthwhile in many areas. So yeah, continue to use it. You're happy on it? You feel good on it?
No, I haven't been on it. That's why I wanted your opinion. I also then am I understanding that you do that also, or you don't?
Yes. Oh yes, we do it. We do it, and we do it well. I'm a big believer in using outside stem cells, not necessarily depending on what the problem is. For example, as you all know, I'm using stem cells on my own arm, which I had a bad break. And by the way, I want to tell you, even though the orthopedic gal is still giving me a hard time, my break actually has moved by, I would say, 40% in the right direction towards healing. So, yeah, and the two ends of the break have already sealed off. So now it's a question of continuing to use something called a bone stimulator, which is what I'm doing. But what you're taking stimulates the cellular communication between the stem cells. So yes, it is actually part of our protocol, and we deliver this vis-a-vis the hydration. So you're a smart lady. Keep it up, girl. Okay?
Yeah.
Thank you.
Thank you. My husband
All right.
and I were both wanting to come in for a consultation.
Yeah,
and we
absolutely.
Really
Come on
Yes,
down.
okay.
Well, come on
Come on
down,
down.
Dolores, and you're not that far. Williamstown is not that far.
No,
from
yeah, I have a lot of
Marlton.
patients from
No.
Williamstown.
Yeah,
Okay.
we're definitely going to make an appointment. Thank you so much.
All
for
right,
the
thank you,
information.
Dolores. And if you're there on Tuesday or Thursday,
You're going to see lovely John.
I'll say hi. Okay.
Okay.
Which brings up this question. I just learned something. The stem cells, there's oral, and then, of course, what you
Well,
do
they're
via
not-
hydration.
Well,
There's a-
listen to me. That the oral stuff is not stem cells itself. That's what
Okay.
I'm trying to say. It's generally something that enhances the cellular communication. These are products. These are constituents that help the stem cells communicate to each other, to the cell, and certainly it won't. It usually doesn't hurt. I'm not going to say that emphatically. But, there is a more direct way to do this by delivering the stem cells. They have a honing device. When we deliver stem cells through the hydration, they have a honing device to go right where they're needed. That's the beauty. That's God-given, my friend. They go there. Now it's up to us. In addition to the regular stem cells that we deliver, we give a lot of nutrition. Just the way I talk about cardiac nutrition, I'm going to talk about stem cell nutrition. And we may give nutrition for the particular stem cells that we're looking to enhance. For example, if it's bone, we might want to use some of the nutraceuticals we know helps bone. If it's something else like anti-aging, we might want to use more vitamin C that produces collagen. So there are so many ways that you do this, but the idea is that won't hurt her. But again, it's not stem cell itself.
Okay, so if you're going to get stem cells, it seems like the hydration way
is a vehicle to deliver the
Right.
stem cells, the actual stem cells that are extracted from live births. That's the difference.
Okay.
Okay.
We got a couple minutes left. Real quick. Men's Health, Valentine's Day, love is in the air.
Love's in the air, man. So listen.
talk about it a little bit.
Well, one thing I know for sure, as I told people before, I believe that our approach to men's health is the right approach in that we are using both the chelation and cardiac nutrition as well as the acoustical wave. All the ads you're seeing on TV generally just use the acoustical wave or some other instrumentation locally on the shaft. We believe this is a systemic problem for men, and until we can improve their cardiac health, we're not going to be able to really improve their sexual health. That's the bottom line. Interestingly enough, I have a patient right now who took 5 chelations. Now, the protocol calls for 20, but he's taken 5 chelations already, and he's been doing the acoustical wave in between. So he's had 3 treatments of the acoustical wave. Obviously, we don't start him right in on that when we start the chelation because we're trying to do what? Want to improve blood flow head to toe. Remember, chelation does that by 12%. Big number. Anyway, this week I got a great Valentine's Day gift because he said to me, "Hey, Dr. Molly, I know you're all about relationships. I said, yeah, I am. I believe that love prevails. I love my patients. I want my patients to have a wonderful relationship in their own relationships. And he said, well, I'm going to tell you a little secret. He said, I was hugging my wife, he said, and all of a sudden I felt somebody was pickpocketing my pocket. Well, I started to laugh because that's telling me that things are happening for him. And by the way, he's a difficult patient because he not only has problems with pain from an accident in the lower back, he also has diabetes, very severe. So believe me, just doing a local acoustical wave is not going to help this guy, not in the long run. He needs to address all the other issues that contribute to ED.
And that's a good point to end the show because we're out of time.
Oh, no, John.
You were on a roll
just
there.
Getting started.
Okay. That's going to put the wraps on another edition of Health Watch. Don't forget, if you want to make an appointment to sit down with Dr. Molly, you've heard some things that you like and you want to find out more, the initial consultation is complimentary, remember. The number is 856-489-0505, 856-489-0505. And remember, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, fabulous Fran, delightful Dee, we have Barbara, we also have Joanne, and our nurses Jess and Crystal, and our medical assistant, don't call me Chatty Cathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week. Happy Valentine's Day. We'll do it all over again next Sunday. Health Watch, 8 till 9, Talk Radio 1210, WPHT. You take care.